Good morning. This is Steve Stites, Chief Medical Officer at the University of Kansas Medical System and our health system. Welcome back to our program this morning. What a weekend, right? What a weekend. And it just feels so hauntingly similar to hear the words, "I can't breathe," from patients and from individuals suffering in the streets. We think about that, and we'll reflect a little bit about that here on the program this morning. But we're going to start with Dana Hawkinson to give us a little bit of an update about how things went here over the weekend.
Yeah, things have been relatively stable over the weekend. Here at the hospital, we have 17 patients in-house, only 5 of which are in the ICU and 3 of which are on ventilators. So again, I think we've had some discharges and some new admissions, but luckily things here have stayed pretty stable.
We're also joined in the studio this morning by Anthony Nickens. Anthony is an employee here at the health system. In fact, he works here in our studio, does a great job here. Anthony is a COVID survivor and developed COVID a number of weeks ago and has had a good recovery. He's also joined on the line by his mom, Maxine Nickens, because there was actually a small household outbreak with you.
Yeah.
And we also have another special guest, Susan Robare. Susan is joining us today. She lost her husband to COVID-19. So we'll be talking a lot about the stories and the impact of COVID-19 on families and even on folks right here in our health system. Anthony, tell us a little bit about what happened with you, and then your mom can talk a little bit about what happened at home.
For sure. So I developed COVID pretty early into the disease being an outbreak in the country, and it was around mid to late March that I started to feel symptoms, and I went home not feeling good from work one day, and I figured I'd stay home the next day. And 2 days later, I found out that I had COVID-19, and by that time I had been at home in quarantine, but of course my family was helping out with me feeling bad, and 2 of my family members that live with me, my mom and my sister, they ended up developing it. My dad, fortunately, did not, but of course, everybody's in a frantic state with COVID being such a new thing and not knowing a cure and not knowing what medicines to even take.
And we were back at a time where we didn't know as much as we do. Here we are 2 months later, really.
Absolutely. And there's new things developing every day. So that added, of course, to the fear of everything happening, but we all made it through, thankfully, and we're certainly aware of the importance of, or even the anomaly that we are in many ways. Yeah,
it really is. And you said that you live down in kind of South Kansas City.
Yeah.
As everybody knows, I'm a Kansas City native, or at least Independence, Missouri native, so know it pretty well. And we were just talking. You went to Ruskin High School,
Yep.
and I went to Ruskin to go do the speech and debate tournaments back because I could run my mouth better than just about any other part of my body. And
I'm with you.
yeah, so it was right there. And so it's a disease that is spread throughout our community, and it has such difficult outcomes. Maxine, Anthony, you're here with Anthony, obviously, and his mom. Tell us a little bit, how scary was this for you and for your family?
Good morning, everybody. It was pretty scary, just the fact that I was trying to protect my son. I was trying to help Anthony, and Anthony was trying to tell Mama, please get away. You know, he was trying to keep me away from him, but I'm like, my baby's sick. So, but it was rough, you know, being that this was so new, like Anthony said, and I was nervous at first when everything started happening, when he was diagnosed, and then I had started feeling sick probably about the same time he did, but I just, you know, didn't think it was anything. But it made me to know that this is for real. It was real, and once I knew I had it, they said lay down and rest. Then I was hearing something different about it's better to move around. So it was hard for me to really rest. Anthony would call me, FaceTime me, Mama, lay down, you know. So
Carry your mom there.
Yes, he was keeping me in check. And so I said, okay, I lay down. I went to sleep for a while, and I woke back up, I didn't stay asleep, but it was an experience. I noticed that I had the worst headache. I never had headaches, and I had terrible headache, fever, and my chest would do a little bit of something, but it didn't. I try to focus, not let myself get overwhelmed, and focus and pray. Number one, I was praying, and we had a lot of people praying for us, our church and everybody. And I think the thing is we just quarantined right away. Just went in our rooms, wherever we were gonna stay. I just went in there and quarantined and just stayed, as much as we could, and didn't go and passing it, because I didn't want nobody else feeling the way I was feeling. So that's why I tell people it's real, and you don't want it's terrible. You don't want nobody else feeling like this. And so we stayed, and we stayed quarantined, and praise God, we made it through.
Indeed.
So,
Susan Robare, you're on. Susan, you're on the. I was just saying, I think our other guest, Susan Robare, is also on the line. And Susan, in your family, this took a much greater and more devastating toll. Thank you so much for having the courage. Thank you for having the courage to be with us today. Talk to us a little bit about.
Oh, you're welcome.
Talk to us about how COVID has affected you.
Well, my husband passed away from it on May 11th. He worked at Lansing Correctional Facility, where there was a big outbreak between both the inmates and the guards. And the morning of April 22nd, he woke up with a high fever, and we separated. He stayed in our bedroom, and I moved to another one. And that day I took him to the local health department to be tested. And then that Friday we got the results that he was positive. So from the time he woke up with the fever, we quarantined. And the only time I would go in there was to give him food, or, to pick stuff up, and I would mask up and I would glove up, and then I would take everything off and wash. And I was real strict about what I did. I didn't go near him at all. And then on April 28th, he said, I think I need to go to the hospital. So I took him to the local hospital, and they admitted him. And then Sunday, I think it was Sunday, May 3rd, that he was put on the respirator.
Well, I'm sorry. That has to be a big loss to you and to your family. We're seeing pictures, I think, of your family. Did anybody else develop COVID-19?
No, thank God nobody did. I quarantined myself after I took him to the hospital on the 28th. So I did not go anywhere. Nobody came to the house. I was by myself. So I'm very grateful that nobody else got it.
Yeah.
Because, like Anthony's mother said, he had the worst headache. Tylenol would not take care of it.
Yeah.
And he ran that fever.
When I'm looking at the pictures of both families a moment ago, and it appeared that, Maxine, you're probably about the same age as Susan's husband. So it's hard to know who's going to live and who's not going to live with this disease. And it's why we want to work so hard to have people try to stay safe as much as possible. So, So Dana, what do we know some more statistics? I think the CDC came out with some more information last week, late in the week, about outcomes in young age groups and older age groups.
Yeah, certainly the older age groups, you're going to be at higher risk of the critical illness and the worse outcomes. But we have to understand this does affect young people as well. You just never know, as you said, you just never know who is going to recover from the disease and who is going to get that secondary inflammatory process where their lungs get damaged and they have to go on the ventilator. It's probably down to the molecular genetic level on your immune system, things of that nature, things you really can't control or have any idea about. And it really is not random, but we just don't know what all the risk factors are for that.
Indeed. And Ms. Robare, Mrs. Robare, you pointed out that your husband worked at the Lansing prison where we know there was a significant outbreak, and those clusters occur because people are in small or in enclosed quarters. And I think, the photographs from a weekend ago and even some more from this week from the Lake of the Ozarks demonstrate concerns, and we know from cell phone data that people from the Lake of the Ozarks have traveled all over our regional area. This is an example of that. You can see kind of the outbreak in the lake area, and then if you watch as they pan out, you can see where all those pictures will go throughout the region, because it can be one hotspot can end up disseminating to many different areas. We're already starting to see patients be hospitalized from Lake of the Ozarks. We know there've been some throughout the area, and some are in ICU. So and all the bright blue on this map represents the cellular data showing where patients or individuals had gone from the bars out to these other areas in our region. So this is the real deal, and we've had two families here that have suffered from COVID-19 in their families, and as I say, our friend here, Anthony, who I say friend because he's been employed, we got to know him down here in the studio, working so closely, and then obviously the Robare family, which has had this great tragedy. Let's open up at first to media questions and see if there are any questions from our media, and then we'll take questions from our audience. Not hearing a media question, I know there's going to be some questions out there from our listening audience today.
There's a lot. They're pouring in. When is a virus considered super contagious? Why is it that one half of a couple gets it and another doesn't?
Yeah, we'll take that one on. It is pretty darn contagious, Dana.
It really is. We don't have a good ideas for why one person gets it and the other doesn't. That may just be down to luck. We know that in a confined space, you are more likely to get it. We know that household contacts are probably more at risk than other people, although we've seen in some of the larger Chinese experience studies or the South Korean, the household contacts, the attack rate is probably 10 to 20%. So we certainly know that people living in the same quarters in the same household are probably at risk as well.
And Anthony, really, it's just a blessing in some ways. I mean, you all practice good social distancing once you knew that someone was sick, but there's that pre-symptomatic phase, which is probably when your mom got it from you. Yeah. Or maybe you got it from your mom. I don't know.
Yeah.
But
We've thrown a lot of options up in the air, and because I was kind of getting down on myself for having it, for contracting it. And she was saying to me, hey, you might have even gotten it from me. We don't know who had it first because we found out literally a day from each other. Yeah. But yeah, we did do that social distancing even within our household. Like she said, I had to kind of be her dad for a little bit and say, hey, stay in your room. You don't have to do the laundry right now. You don't have to fold clothes right now. Relax, rest. But it's hard for people. It's not normal for us. Especially for my family. Everybody's always doing something. And for my sister, I was able to just kind of know that she was in her room. But for my mom, that's somebody I had to check on constantly. And that's another important part of this is making sure that your family members are safe, knowing their personality types, because certainly they're going to continue to do what they want to do, but you have to be that reminding factor of, hey, you're sick right now and you need to relax.
And Susan, in seeing the pictures of your family, you have, it looks like a son and a daughter there with you. I'm guessing that you had to work hard to keep everybody safe.
We just had a daughter. That gentleman in the picture is our future son-in-law. they were supposed to get married May 2nd this year, but obviously they postponed the wedding earlier because of COVID. And then they were going to try to get, you know, a license to where they could do it small group on May 2nd. Well, obviously that didn't happen. So the wedding was postponed.
Wow, the toll just goes on and on, doesn't it? It's just so hard.
Yes. We had to postpone to later in June because of a special ceremony we are.
Well, those are, I mean, again, you're so courageous just to be on the show. All of y'all are, to be on the show to talk about this disease. Let's hear if there's another question out there.
Well, there is for Susan and for Maxine. If they want to share, did Susan's husband have underlying conditions, and does Maxine have underlying conditions? People are really trying to understand.
Yeah. Maxine, so I think this is a big point for everybody, that folks are they're looking for some reason that it won't be them, and so they're saying, oh, maybe they'll have an underlying condition, and that'll help explain it. So let's turn that, Susan. Did your husband have underlying health concerns?
He had fought hairy cell leukemia for 3 different times, but had been in remission for about 5 years from that. 3 years ago, he had to have part of his esophagus removed because he had an autoimmune disorder, and his stomach was pulled up and reattached to what little bit of his esophagus was left. But otherwise, he was healthy.
Yeah, and he looks like you guys are pretty active out there, and you were out there at theater and all those things.
Oh yeah, we had traveled to California last year. We had, he did volleyball in the fall. He was normally a healthy guy.
Maxine, how about you? And you don't have to talk about your health concerns if you don't want to, so it's up to you. But are you otherwise healthy?
Oh, you asking me?
Yes.
Maxine? I'm sorry. With me, I've dealt with asthma, allergic rhinitis. I deal with heart failure. I have diastolic heart failure, and those are some of the ones, and I'm anemic.
Well, I'll tell you, I'm 60 years old, and I have prostate cancer. It's very mild. I don't have to. I'm in long-term follow-up, I hope, and some sleep apnea. And I get nervous every time I hear about this COVID-19 a little bit, Dana, because as you get older, anything can happen, right? It can affect you in any way, and so I think talk to us a little bit about that. We'd like to feel safe if we think we're totally healthy. Yeah. I walk about 3 miles a day, but the reality is COVID-19 can take down healthy people as well as unhealthy people.
Yeah, and I have those concerns, I'm 45, relatively healthy, high blood pressure, but try to stay active. But we understand, even though we may not be in that higher risk category, we know and we've seen young people that have gotten severe illness with no underlying health disease. And it's really rolling the dice because we don't know who will develop that inflammatory dysregulation and that cytokine storm. And so it's very dangerous to choose, even though we look to say, well, I don't have this or I don't have that. That doesn't really seem to matter too much in these infections. Again, we still haven't got the full knowledge of really who is at risk. And again, that's probably a cellular and molecular level for any one person's immune system. So until that time, we all have to be careful and do our due diligence, because that could be us. And we just don't have a way to predict, other than the general broad terms that we know of, who will develop the blood clots 3 weeks later, the blood clots in your legs or your lungs. Because we've known and we've all seen those stories on the national media about otherwise healthy people who do develop those complications and die.
And we've lost some people here who did not survive, who were otherwise healthy and young. Now, again, the preponderance is older and more difficult diseases, but don't think you're immune from this just because you don't. You talk about the cytokine storm, which is sort of this really, your body sort of turning on yourself. I mean, up in the ICU, we used to talk about how that was really like short-circuiting your entire immune and your blood vessels, and man, everything just goes wrong when things get short-circuited. You can think of all the smoke that pops out and all the things that are going on in there when we say short-circuit. But that's really what all that cytokine storm and inflammation, that's what it is. It's your body short-circuiting, and why sometimes it's triggered in one person and not in another. We don't know. You've done great, Anthony. I mean, you and I have talked a little bit about it. You have, I think, a little asthma, and you even said to me, "But I'm feeling much better." This was a few weeks ago.
Yeah, even probably like a week after I was able to return to work, I told Dr. Stites, I was like, "There's something going on in my chest still, and I don't know if it's something that I should keep an eye on." And he just kind of like said, just relax. You're just coming down from COVID, and all these other things might be factors. Just let me know what happens in a week. Come back a week later, we're good.
Yeah.
So it's
if
just.
it got worse, you and I were going to get together.
Yeah. We were going to have. It seems like we were going to have a
clinic.
conversation after
Yes,
that.
we were.
But for sure.
Yeah.
But those long-term complications do persist as well. I was speaking with a patient who had it 6 or 8 weeks ago, but she will still get this reactive airway process. For some reason or another, something will offset it, and she will have trouble breathing, deep tightness in her chest, burning in her chest. And this is someone who's recovered and otherwise relatively healthy.
And it's kind of like, we sometimes see that with influenza or metapneumovirus or different viruses, that some people just have this more prolonged recovery than others. I just think it's a little more prominent in COVID-19 than it is in some of the others. So,
Is it true that 80% of the prison population in Lansing were asymptomatic?
I don't know for sure. Susan, do you know what percentage of the prison population from either guards or prisoners were symptomatic versus asymptomatic?
No, I do not.
I think a lot of them were. I do remember that. And do you know,
I
Dana?
can imagine they from what we know now, they possibly could be asymptomatic or very mild disease. I don't think I know the numbers right offhand.
I know Lansing has an infirmary with, I want to say, about 40 beds. And they had a much higher number than that test positive of the prisoners and the guards. I believe it.
Oh, yeah, they had like over 900 test positive.
Yeah. So I think a lot of them, I don't know about asymptomatic, but they were at least mildly symptomatic, so they didn't require a lot of medical attention. But there were a lot of positives and people who didn't have symptoms. I think that's true. And then they were struggling with how to quarantine everybody. So.
We have several questions related to the activity around the metro this weekend. They want to know what impact the COVID virus might have on those people. Were they?
Yeah.
Well, this is
Social
a picture on
distancing?
our screen now. There's a photo that I'm seeing, I think you're seeing, of a lot of people marching. This is in Kansas City. And I do want to say, I see a lot of mask wearing. That's great. Not everybody. But mask wearing is important because people in close quarters are no different than the Lake of the Ozarks or the streets of Kansas City, Dana.
No, I agree. When we first started talking about universal mask wearing, again, these are, for the most part, we're talking about the cotton cloth face masks. There was a lot of consternation and debate and politicalization of that about freedom of speech. We have always said we want you to be able to demonstrate, protest. It's not about freedom of speech. You can still have freedom of speech, but please wear your mask. The other thing we wanted is people to be outside, and if you have to do that, we said we were always be 6, 8, 10 feet away from each other. So that is the combination of wearing the face mask and continuing to physical distance. Obviously, in some of these demonstrations, they were unable to physical distance, and I would agree with you. Just like the Lake of the Ozarks, you're still in pretty close quarters, even though you are outside. There are a lot of people who are pretty close to each other, and that's really the danger.
I think the key is that even exercising your right to freedom of speech and protesting injustice doesn't going to keep you immune from spreading a disease like COVID-19. Don't succumb to the disease trying to do something you think is right. Anthony, that had to be moving to you. You and I were talking a little bit before we started the program, because this is a health program, right?
Yeah.
And we always try and stay in our pathway. But it's hard not to reflect on the events of the weekend and think about parallels with COVID-19. You talked about that better than I did.
Absolutely. Well, I don't know if I talked about it better than you
No,
did.
you did. You
but-
did a great job.
No, but I was just mentioning to Dr. Stites, he was saying how it's amazing how I Can't Breathe has been the moniker for COVID, and then it's also been the moniker for Black folks. And I was just remarking to him, I was saying, well, now it seems that we're kind of like on a playing field where we understand that, hey, now I have some restrictions in life. I can't go everywhere I want to go. I can't do everything I want to do. I can't be as free as I want to be. That's with the COVID folks. But African Americans have kind of been in that situation for a long time. Whether you caused it or not, we are in a state of pretty much emergency where we are having to see eye to eye. And if we don't see eye to eye, we still have to find ways to say, hey, that's a human being. I have to appreciate their opinion. And at the same time, I want you to be safe. So I think the main thing for everybody is to preach safety. Don't try to politicize everything, like you were saying. Don't try to politicize everything, but preach that safety and recognize that somebody has a voice and they have to get it out, because we're all at home. We're watching the news. We're stuck at home watching the news, and it's on people's minds. So they feel like they don't necessarily they can't do everything that they want to do at the time. So in any way that they can, they're going to try to demonstrate. But I think the main thing that we ought to do is just to let people know we hear them, and that to stay safe, to wear the mask when you're marching or when you're protesting, to keep that 6 feet distance.
I know I was in church. I was Zooming this weekend, and we were talking about the events, and our church is right there on the plaza. We were Zooming, but I think one of the important points, and I think our minister Shanna Stites made this from Community Christian Church. The first commandment does not have an asterisk. I didn't say asterisk very well. Asterisk. Okay, thank you. It didn't have one of those about love thy neighbor as yourself, but only if they're white, black, pink, yellow, brown, whatever.
Right.
And it's not asterisk. And I think that's how we have to approach this.
Absolutely.
And it's we're all in this together, just as we're all in this pandemic together. It is an interesting time about that. Jill, another question.
Oh, yes. Several people are asking about a Reuters article that is talking about an Italian study claiming that that the virus has gotten less potent. Is that a new strain?
Dana, let's talk about that, because we all want to believe that stuff, because that's like good news.
I got excited.
Is that wishful thinking?
Yeah. Okay. So we do understand about the phylogeny of this virus, meaning where it came from, the molecular makeup, the genome, the molecular genetics of all that. There haven't been too many changes in that genome, the base pairs, the genetic material, probably 15 or 20 since the first isolate in China. At this point, there is no clinically relevant difference between the viruses. They have talked about different clades or different groupings or different subtypes, but right now, from what we have seen and what we know about the molecular and the clinical, there hasn't been any difference or clinically relevant different strain circulating around the world. So,
All right. So mask wearing, it says, I know you've said wearing masks will protect others, but will it protect me?
So, Dana, that's a common question about trying to protect yourself. Those cloth masks, not so much, and maybe the surgical masks a little bit more, but really you need an N95 to get real protection from yourself or yourself.
yeah, absolutely. So we've always talked about the cloth face masks. That is to help reduce any spread from the source. As they've looked at other studies, you may get a little bit of protection from wearing the mask itself. We certainly would not use that protection through the standards of healthcare workers while in the hospital, but certainly a little bit is better than nothing. So certainly it could help. And when both people are wearing masks, you have a little bit more source control. You have a little bit more a little bit less droplets eventually getting further from the source. So overall, that is our main talking point here, is that if both people are wearing masks, you certainly can reduce it. But for the purposes of hospital and healthcare workers, Again, the cloth face masks are not going to be to the standard. We would still use the surgical mask and the N95 mask.
Is our immune system weakened by months of social distancing, mask wearing, and hand sanitizing?
That's an interesting question. We hear that from time to time, that being in our house, we're not going to have our same immune system.
Yeah.
But fortunately, that is not how the immune system is programmed.
Right.
In fact, if you're eating well and sleeping well and taking good care of yourself and exercising, your immune system may even be better by being at home. So,
Yeah, we need, for whole body wellness, certainly nutrition and sleep is very good. Activity is very good. All those things are very important for your immune system. Doing the physical distancing, doing the proper body hygiene, showering frequently, but also the hand hygiene, the hand sanitization daily and frequently throughout the day is not going to affect your immune system. You are still getting samples from pathogens and other environmental sources daily by just breathing in, by also ingesting things of that nature. So this will not, doing what we are endorsing is not going to reduce your immune system at all.
I would just say the other thing, you can always, if you're worried about that, give your dog a hug, play with your cat,
Yeah.
go outside,
Yeah.
roll in the dirt, because you're going to find plenty of pathogens out there. You don't really have to worry about going to find your neighbor in
No.
order to find more pathogens. They're right there in your house, and it's easy. They're easy enough to get to.
I mean, a lot of people like you said, hugging their dog. A lot of people like kissing their dog, getting their dog licking their mouth. Have you seen
quite did that one.
where your dog has been licking lately? So I think just talking about that, and most people don't have a problem with that. Again, the
I
main.
kiss my wife.
The
and
main
I think
point.
that's a good thing. I think that does that count?
Well, but
too?
she's exceptional, and I think she has to say that about you.
Okay, Dan.
She has to
Are
call
you
in
coming
and
back to the
ask.
show tomorrow? What time is it?
I kissed Dr. Stites. Is that a problem? We can answer that offline. But yeah, I mean, people do that. The main focus of this point is that doing these things that we are endorsing to try and keep you safe from COVID is not going to reduce your immune system.
Here's a good question while we're trying to expand our social bubble. Will it be safe for my 77-year-old mother to visit us this summer, or should we go visit her? Which is safer?
That's a good question, Dana. What do you think? That's a hard one. It sort of depends on whether your 77-year-old mother, how they're going to get to your house, I think.
That's what I was thinking, the mode of transportation. Is it driving? Is it flying? Certainly we have always talked about there's probably more risk involved in flying because you have to go to the airport because you are in that flying tube for an hour, 2 hours, 3 hours at a time. But if you're driving, if you can make it through on one trip, maybe stop for gas, that will reduce your risk as well. So I think the main point is we were just concerned about the mode of transportation to get there is the biggest issue.
Yeah, and I think there's really no great answer to that because there's so many variables, right? How many people are going to see your mother? Is it one? Okay, then it's probably better for you to go. But if there's a whole cadre of people going there and they're all going to be traveling, then there's a lot more chances to pick stuff up.
Right.
On the other hand, a 77-year-old traveling, oh man, I don't like it, especially if it's an air flight. So I think it just makes it harder. Susan and Maxine, what advice would you give people right now? I mean, again, Susan, you've been through tragedy around this. Maxine, you had to be scared, and for your family and your children. What would you say to people out there who aren't wearing masks and not doing good hand hygiene or going down to the lake and hanging out at bars?
Susan, I would say, I said this to my job. I've been working from home. I work for the Internal Revenue Service, and I even in meetings that we've had, I've told them this is real, and a lot of them don't even know I had it, but I let them know it's real. Don't play with it. Stay safe. I don't know. To me, the coronavirus is sneaky. I don't know why. I just think I'm just like it's sneaky because you don't know where it is.
I think that's right.
I'm just like stay safe. Don't play with it. Wash your hands. Wash your clothes. Wash your body. My niece was telling us yesterday. Wash the bottom of your shoes. We've been out walking, and it's just so you never know where it is. So please know that it's real and know that you're not exempt from it. I think a lot of people think they're exempt from it. You're not exempt. you got to protect yourself. And even my husband, and it was just such a blessing how he took care of us, and he's still been pretty healthy, and he hasn't developed the virus. And I praise God. I have to praise God for that. So if you take care of yourself, you do have to take care of yourself. So thank you.
You bet. Susan, this has touched your life in such a tragic way. When you see people out there not wearing masks, not social distancing, does it make you want to scream?
Yes, it does. I've thought about making a sign when I go out. Of course, I just go out for the very basics. I've felt like making a sign and saying, you don't know who you're going to affect. My husband died from this. It is serious. People think they're immune to it, and they're not. They may be asymptomatic, but you don't know who you're going to take it home to. And you don't know who those people are going to take it to. So please take it seriously. Do what you can to protect yourself and your loved ones.
I think that's really the key message, Dana, right? I think that is really the whole thing.
And I think a lot of people would say, well, I would wear a mask if I was sick. And the CDC said, and Dr. Fauci said, I wouldn't wear a mask unless I was sick. Unfortunately, we have to remember for this virus, you are probably most infectious and most at risk of spreading it to other people 1 to 2, maybe even a couple more days prior to any symptoms at all, to a few days after your symptoms. So that's the important part, is we don't always know who is sick. And again, now if we have the CDC saying, up to 30% of people will overall be asymptomatic, which is certainly different from the original Chinese experience where they said, well, maybe just 2% of people are asymptomatic. So that's important to note, that you could be spreading the disease or virus without you feeling sick at all ever, or 1 to 2 days prior to even you getting symptoms. And so that's the real crux of all this, is you just don't know and don't understand that you may be spreading the disease.
Yeah. The virus isn't just anywhere, it's everywhere. And that's our struggle, isn't it? I think we have time for one more question.
Well, could you explain a little bit about what an underlying condition is? This person asks, I had a subdural hematoma and had surgery in 2019. Am I compromised?
Yeah, what is an underlying condition? That's a funny thing, because in medicine, anytime you have underlying conditions, it does affect how you do, whether you're going to go through heart surgery, or you have lung disease, or cancer, or diabetes, or high blood pressure, or asthma, or emphysema, or any of those kind of chronic things that affect most Americans. What we know is that every time you have one problem with your body or one health issue, it's easier for another health problem to A, strike, and B, cause more toil and trouble to you. And really, it's hard to know, because there's so many factors that blend in. For example, if you've had a history of cancer, but you're not actively getting chemotherapy, your risk's pretty, let's even say your cancer's in remission, then your risk may not be greater than the general population. But where are you? Are you truly in remission or not in remission? If you have emphysema, are you having an exacerbation already when you get COVID-19? That's going to have a major effect. And how good is your lung function relative to the degree of emphysema? Are you already needing to be on oxygen? All these things have an impact on us, and they all help push one way or the other for how serious we're going to have COVID-19. Most of all, it's just unpredictable. And you can hear that in our conversation this morning. We have Anthony and Maxine from one family. They got it. Your sister, right?
Yep.
And your dad did not get it. And then we have Susan Robare, and her husband passed away from it. How do we explain that difference? We really can't.
Yeah.
We just know that it exists. And the best way to have to not understand it is to just stay safe.
Yeah.
And the way you stay safe is the same things, the pillars of this infection control that we talk about all the time. Wash your hands. Don't touch your face. Cough into your elbow. Wear your mask. Don't go outside and infect others when you're sick.
I just wanted to add one public comment about Anthony. As his boss, I wanted to let everyone know that is watching or listening that we have a high traffic area, and it is a small space. And we practice all of the things that Dr. Stites and Dr. Hawkinson teaches us. And one of Anthony's job was to make sure between every single visit that this whole place was washed down, and he with disinfectant. And he did that even on the day that he was coming down with COVID, and we didn't know it, right?
And you did. And we don't have anybody else down here that got sick.
No.
Nobody else.
No.
That's
and he was
impressive.
in some of this happened too, as he said, early, before we knew about a lot of distancing and those kind of
Yeah.
things. And I just wanted to say thank you to Anthony, because I believe that he protected us even when he was sick.
Final thoughts, Anthony, from today?
I see Logan nodding in the
Logan's
sound
in the
room.
studio. Anthony and Logan work together right side by side, and Logan's happy to be healthy.
He's like so grateful that I got it and he didn't get it. No, no. But my final words are just to let's all be sensitive to each other during this time, and that means basically make sure that you're safe. Make sure that you're keeping others safe. If you're going out, if you're doing something with a lot of public activity, keep that social distance. I know it's really difficult, especially when you see people that you know and they're starting to let up on the restrictions here, especially in Kansas City. But still be mindful that this is a disease that can kill some people, and you don't want to have to deal with a funeral. It's just so difficult dealing even with that during this time, because you can't have everybody around you. I didn't mention, but we lost my aunt. She had hypertension of the lungs during this time, and it was just so difficult because we're a large family, and I can only imagine what Susan is going through. But let's be sensitive to each other at this time and keep ourselves safe and keep our family safe.
Beautifully said. Ms. Nickens, anything you want to add? By the way, your husband, your son here, he's a pretty smart guy.
Yes, he is. Yes, he is. He know how to use the words and everything. I love it. But he's right, and I did lose my sister. She had a double lung surgery, double lung implant, September of 2019, and we lost her on May 10th. And she fought a good battle, and that hypertension is something else. And I just want people to be encouraged and know it's going to be all right. But until then, we got to keep sticking to what the CDC is telling us, what you all, the doctors and nurses are telling us, to wash our hands, be safe, keep our mouths and nose covered, distancing, the same thing. I piggyback after Anthony. Just know and not be selfish. Not be selfish. Because you want to go out and do something, don't be selfish. That has a lot to do with it. A lot of people are selfish, but don't be selfish. Think about somebody else sometimes. Think about somebody else's life. Think about those that have lost loved ones, and just stay safe. Thank you.
You bet. Thank you. And Susan, gosh, your family has paid the price of not being able to stay safe with COVID-19.
Yes, we've paid the ultimate price. And no family should have to go through this.
Yeah, that is.
Because they chose not to follow the recommendations.
Thank you. And thanks for being on the show today, and took a lot of courage and heart to be here for all of you all. And I just wanted to say thank you. Dan, any final thoughts today?
Nope. I just want to 100% echo the thoughts of our wonderful guests today. Absolutely.
Yeah, it has been really impressive. You guys have just done a great job. And I just want to reflecting on Anthony's point that in some ways this pandemic has made us all feel isolated. And sometimes that's what our African American community does feel a lot of times. You know, I'm an old lung doctor. I'm old now officially. In my practice, when my patients say, I can't breathe, that's not good, right? You know, I'm a lung doc, and these patients start saying, Doc, I can't breathe. That's like either get to the hospital, get to the emergency room, go get help. I can't breathe should scare all of us. And the way we solve for it is we take care of each other without any asterisk. That's how we be here. That's how we can be here tomorrow. So in the meantime, if you see somebody out there that can't breathe, give them a hand. Give them a hand. We'll be here tomorrow. Stay safe out there.